The NHS has transformed over the last 20 years. Public satisfaction with NHS services has grown from 34% 20 years ago to 57% in 2017. One of the drivers of this improvement has been transformed leadership practices in the NHS.
My experience of care was originally bad, really, because it was prescribed, it was what everybody else gets. It wasn't tailored to me, and 10 years into my injury, people started treating me as an individual, as a person, and that made a terrific difference.
I started the NHS in 1979 as a porter in St James's Hospital, South London. And leadership and management in the NHS appeared remote, disconnected with the heat and burden of delivering patient care. I also saw a number of examples of arrogance, where some very senior staff would dismiss occasionally me and others for being so junior that they were inconsequential.
Today, leadership is different in that it's less top-down than it was, I believe, and I think that's a good thing. There's a lot more dialogue between staff, managers, leaders.
NHS leadership to me is about leadership at all levels, and it is about inclusivity, creativity, and sort of being able to take people along with you.
Since 2012, the NHS Leadership Academy has been supporting leaders to drive this change. Over 130,000 people to date have accessed NHS Leadership Academy programmes and resources, with NHS staff coming from every trust and every clinical commissioning group across England.
The NHS Leadership Academy's purpose is to ensure there are the right number of leaders with the knowledge, skills, attitudes and behaviours that we know transform health and care across our service.
That means we need to take talent management seriously. It means that we have to nurture talent and leadership literally from an early stage in the arc of someone's career to the final stage of their working lives.
The Academy have led the design and development of leadership programmes that thousands of people have been through now, and they've definitely had that framework of transformational leadership, engaging patients and the public as well as staff.
My motivation to join the Academy was to link up with other people, to have a space to think creatively about the challenges that we face.
Undertaking the NHS Leadership Programme has made me reevaluate about the patient and why I'm there, ultimately focusing on improving outcomes and patient experience.
And I think the Leadership Academy plays a very important role in enabling leaders to gain the knowledge and skills and the confidence to work in different ways that will lead to a better quality of leadership.
In 2018, Ipsos Mori found that 80% of NHS decision makers reported that the NHS Leadership Academy was having a positive impact on developing more professional leaders. In recent qualitative research, NHS managers were found to identify NHS Leadership Academy programmes as high quality and good value for money.
Across the whole NHS, we're looking to try and do things differently. We have to change, adapt and evolve at pace, and I think we are doing that. And part of that is how we think and operate as leaders and the implications for our talent management. And I think at the heart of this, from a talent management perspective, is the question and challenge around diversity and inclusion.
It will always benefit from the deep compassion and dedication of staff, but in the future it will increasingly benefit from the digital revolution.
We need to be really realistic about how we work with patients for the best outcomes for them. That resources are going to be finite, that we have a responsibility to use our resources effectively and efficiently, and also be minded that we need to get the best outcome for patients.
Into the future, the NHS Leadership Academy is expanding the scale and reach of its programme offer. We're also going to be at the heart of developing a talent management approach across the NHS, helping our service collaborate and not compete for talent.
It's a huge honour and a privilege to be a leader in the NHS. It's not, in my view, a job. So I think that we all look up to our leaders in the health service to make sure that we do the right thing for the people that we're here to serve.
It's a very exciting time to get involved because it's just going to change massively. And I think the whole emphasis is going to be on keeping people well and not being patients If I was giving advice to leaders of tomorrow's NHS, I would say be brave and be creative.
The NHS Leadership Academy, here to support leaders to deliver ever better, patient-centred, compassionate and collaborative care.